I'm Dr. James Savitz with OrthoHeal, and I'm going to show you the short arm immobilizer. So a short arm immobilizer is going to be for any kind of wrist issue, whether it's a distal radius fracture or a wrist sprain. And so the first thing that we're going to do is I need to get some measurements. So I'm going to take a tape measure right here, and I'm going to measure her hand circumference, her wrist circumference, and her forearm length in centimeters. Okay? So I'm going to start with the hand circumference. She's got about 21 centimeters for the hand. She's got about 17 centimeters for the wrist circumference. And now I need to do the forearm length. So we're going from the olecranon process all the way to the ulnar styloid process. That is about 26 centimeters. Okay, so I got my measurements. I'm going to take a look at this OrthoHeal chart for the short arm, right? Mid-palm circumference, forearm length. She fits right into a large. So she fits right into a large. We'll just happen to have a large short arm immobilizer right here, large short arm immobilizer. You can see the expiration date as well. So I'm going to open up the box. So put that right there. I'm going to put this over to the side here. I'm going to take out the bag that actually has the immobilizer in it, along with some instructions for provider use here. And this is really important, that make sure anyone who is handling one of the braces and working with patients thoroughly understands the instructions for use. It goes into significant detail on the general description of the brace, the key feature, the intended use, the indications, contraindications, as well as a size chart to make it easier for measurement. So I'm going to put that there. You're going to get this black bag here. The brace is in this bag to help prevent any light exposure to the brace. Anytime that the brace is exposed to light, whether it be artificial or natural, it's going to start the curing process. Right? We want to make sure that we keep it in this bag until we're ready to use it. And so before I open this up, I'm going to put on a pair of gloves just in case there's any gel leakage coming out of the silicone. So I'm going to put my gloves on. You can take a pair of scissors. Fairly easy to cut open. Let the cylinders down. And this is the short arm immobilizer. Okay, as soon as I open it up, I'm going to take a look at the silicone that has the gel inside, and I'm going to make sure that the silicone isn't leaking any of that gel. If it is, I can put it back in the package and contact the manufacturer for a replacement. Looks good. Looks good. Good. So this is the superficial side that's going on the outside. This is the deep end of the brace. This is a foam rubber here. It's actually going to go onto the skin. And this is really important. This is what's going to protect the patient's skin from the resin that's inside the silicone. So we want to make sure that there's no cracks. Good. Okay. Good. Another item that came in the package is this piece of foam right here, which is the same material that's on the inside of the immobilizer right here. It's the same material that's on the inside of the immobilizer, and this is going to protect the thumb and allow for a little bit more thumb movement. It's going to protect the web base as well as the scaphoid and that CMC joint. Okay, so before I put any of that on, I want to do an inspection, make sure there's no open wounds, no infection, check your pulse, cap restill, good. Dermatomes, can you feel this? Can you feel this, this, and this? Always check bilaterally to make sure that they're equal. Good. Equal cap refill, can you feel this? Can you feel that? Can you feel there? So before I put the immobilizer on, I'm going to take the thumb wedge. Larger portion of the thumb wedge goes below the thumb, covering up the carpal metacarpal joint into the scaphoid. The smaller point sits right in the web space and covers up that thenar eminence. And if you take a look at the brace, you can see that it's much thinner up here and much wider down here. That's by design. A lot of individuals have larger forearms and smaller wrists, and this helps accommodate those patients. You can see the elasticity of the brace at the distal end, right, versus the proximal end. Not as elastic, still elastic, but not nearly as flexible as up here. So this allows for a lot more room. Okay, we're gonna go ahead and just put the brace on. This should sit nice and snug. I'm gonna have my patient go up like we're gonna arm wrestle really quick. And I'm just gonna attach the zipper on the ulnar side. And as soon as it clicks in, make sure that you move it around a little bit without displacing any kind of fractures or injuring your patient. But you want to move the immobilizer around so it sits on the lateral aspect right by the ulna, going down that ulnar shaft. And as I'm going towards the elbow, you want to distract a little bit just to make sure you don't pinch your patient's skin. All right, so now I have the brace fully on. I want to do another inspection to make sure that there was no leakage in the silicone, that none of the gel or the resin is leaking through. And I'd also want to make sure that the foam pad is giving plenty of room between the top layer of the skin and the bottom layer of the gel. And it looks like that's the case throughout the entire brace. I want to make sure that my patient has good thumb mobility. They can do opposition and reposition. They can come over and pinch their pinky and go all the way through and go back. Good. And now we are going to get ready to cure. Okay. Now, before we cure, I do to make sure that I keep myself protected and I also keep my patient protected. So I'm going to give her these glasses as well. And this is the blue light that we're going to use to cure the silicone that's going to harden up and create that immobility in the brace. Right? I'm going to turn this on. It's a bright blue light, and I'm going to point it away from my patient's eyes and away from my eyes, and I'm going to focus it first on the fracture site. I want that area to cure first. I want that area to be immobile first. And every couple of seconds, we're going to hear a beep. After that beep, that's the light telling me that area is cured and I can move to another location. Okay? You ready? Now I'm going to tell my patient that this is going to be warm. I'm keeping this a couple inches away. This is going to get warm. So if it gets too uncomfortable, please let me know and we can stop. You can already feel it starting to warm up, can you? Yes. Good. I can feel it also. And now I'm going to go on the dorsal aspect of the wrist here, doing the same thing. making sure my patient is comfortable, making sure she's not in any pain. Good. I'm going to go on the palmar aspect of the wrist also. I'm going to go on the radial side. I'm going to come over here on the palm, and I can see that I have a little bit of a gap right here. I want to close that gap. I want to close that gap. So I'm going to add a little bit of pressure, and I'm going to push down. I'm also going to have my patient spread her fingers. Right? You're going to ask your patients to spread their fingers just in case they have slight claustrophobia. This might decrease that likelihood that they might experience an episode. And then I'm going to work my way down the wrist into the forearm and making sure that the entire brace is nice and cured, it's nice and solidified. As I'm doing all this, I'm inspecting as well. The inspection never stops. Keeping in constant communication with my patient, making sure that they're comfortable. Are you doing okay? Good. Keeping constant communication with my patient, making sure that they're comfortable, that they understand that this may get a little warm, but it's not going to be painful. We're almost done. I'm going to do one more area right over here. And then I'm going to turn off the light. And I'm going to do another inspection. But this time, not only am I looking for any kind of gel leakage, but I'm feeling for any soft spots. There's a few soft spots that I can feel over here, right? And maybe right over here. So not only am I looking for soft spots with those palpations, but I'm also feeling the silicone and making sure that it's nice and snug. It shouldn't be loose. Right? And I don't think I have any of those areas. So I'm just going to take my blue light and get one more right over here. Was that it? Yes. I'm just going to harden this area one more time. And if my patient at any point is telling me that it's getting too comfortable or too uncomfortable around the zipper area, what I can do is I can take a piece of this rubber. This is the same material that is made of the thumb wedge, as well as the items that's pressing against the skin that's protecting it from the silicone, right? I can put this underneath that as well and make sure that the skin is nice and protected from the zipper. So we're good. Inspection is done. Cap refill is done. Can you feel this? Can you feel this? Always check bilaterally. Can you feel this? Good. And now this is completely solid. You might run into a situation where you have a non-compliant patient and they might be enticed to remove this zipper, unzip the brace, and try to take themselves out. So how we can prevent that is we actually take our splitters here and just go right to the face of the zipper and just cut it. This way, it's impossible for anybody to take the zipper and try to unzipper the brace. If for whatever reason the patient needed to get an X-ray or an MRI, this is X-ray and MRI safe. The only metal that's on the product is on the owner's side. So for a short arm, and if the patient has a distal radius issue or anything going on the radial side, the metal from the zipper will not interfere in any X-ray, and the metal on this side won't pull in the MRI tube either. If your patient has a wound or an abrasion or an infection underneath the skin and you need to get access to the skin through the brace, you could take the splitters and you could cut a window out of the rib right? And you don't want to push down too hard. You just want to cut where the silicone is. You don't want to cut where the rubber is. You okay? Talk to your patient. Make sure you establish that rapport with them. You can just pull out a window here, and you could do wound care. And this will not affect the healing process at all, or the immobilization process at all. So now I have a nice window. And the only reason why I'm getting all these little pieces is because I just cured it a couple minutes ago. Over 24 hours, if I were to crack this, it would crack completely clean. But now I have a little window here where I can access any kind of wound, infection, abrasion, whatever the case may be. You can bathe with this. You can shower with this. You can go into the ocean. You can go into the pool. However, if you do go into salt water like the ocean or chlorinated water like the pool, we recommend that you rinse it thoroughly with fresh water. And if your skin is still wet afterwards, you can take a hair dryer on the pool setting and you could just blow dry that, and that will take care of any kind of dampness that you may have on your skin. If at any point over the next 24 to 48 hours after application, you do experience some sort of adverse reaction or some sort of allergic reaction, please call the provider and make sure that you come in so we could take the brace off. And now we're ready to completely cut this off, right? And what we're going to do is we're going to take our splitters and we're going to cut each of these ribs in a straight line going down the dorsal side of the hand all the way to the palm. But now I'm going to take it off and I'm going to do exactly what I did to open that window, but I'm going to go from the proximal end of the dorsal side of the forearm all the way to the hand. And I'm going to get it off that way. Talking to my patient, asking them if they're okay. You okay?
Yeah.
Good. All the way down. And right here. Open it up a little bit. Good. Nice and loose. Nice and loose going down. I'm going to unzip, which I can't because I cut. So now I need to take a pair of scissors. And now I need to cut it. And I'm going to go from the distal end over here all the way in the proximal end. If you have bandage scissors, I would recommend them. We have trauma shears. You okay? I understand that. Well, a little bit more. Try not to cut my patient. Little bit close. This area is a high traffic area. It's a little sensitive. And we're able to fully pull that off. No issues. I can remove this thumb leg. Right? I'm going to do another inspection. No issues. Check dermatomes. Can you feel that? Can you feel that?
Yeah.
Good. Check cap refill. Good. Check pulse. And then check bilaterally.